Hello everyone, welcome to the e-lecture series of Pharmacy Practice. Today we will discuss about the organization structure and medical staff in the chapter Hospital and its Organization. This is the second lecture of Pharmacy Practice. In the first lecture we have discussed about the definition, classification of hospital, primary, secondary and tertiary hospitals, and classification on the basis of clinical and non-clinical basis. So today in this lecture we will discuss about the organization structure and the medical staff. So first, organization of hospital resembles very much with the industrial plant. For example, in industry, or if we are considering any commercial entity, then there is also the presence of general manager or the executive vice president. Here in hospital also, there is a director or superintendent. So in both the things, if we are considering, then both the things, they are governed by corporation or by the board of trustee. So here, if we are considering the first step or in the organization, then first one, there is a corporation or government. Then afterwards, the governing council, or we can say the board of trustee, and then afterwards the superintendent or the director of the hospital. Then again, this is all the things that is divided into the four different parts. We can say first one, associate director or head clinical services, then associate director or head specialized services, associate director or head pharmacy services, and associate director or head administrative services. Then again, if we are considering this, then this four classification, this four division, they are also divided in different. For example, head clinical services, that is divided into the medicine, surgery, radiology, pathology, clinical laboratory, blood bank, and research laboratory. Then if we are considering about the specialized services, then specialized services, that is also divided into the nursing services, then dietary services, then physiotherapy, then medico-social and medico-legal services, and central sterile services. Then the pharmacy services, or we can say the associate director or head pharmacy services. Under the supervision of pharmacy services, there will be the manufacturing unit, then the drug purchase and distribution, drug information services, therapeutic monitoring services, and medical record keeping services. Then if we are considering about the administrative services, see in hospital, this is also very much important. The management of the administration, that is the very much important. Then under this, there will be the grants and contracts, credit services, telephone services, housekeeping and laundry. This will be under the supervision of the head administrative services. So we can say this one is a general classification, or we can say this one is a administrative organization pattern in a hospital. Now we will discuss about the one-to-one about the clinical services, specialized services, pharmacy services, and administrative services. So first, we will start with the governing body. See, the government body, that is the top management in the hospital. We can say it is the highest decision-making body of a hospital. Governing body appoints its own chairman, vice chairman, secretary, treasurer, and members. Most important function of governing body, we can say, that is to appoint an administrator. This governing body, they will appoint one of the administrator for the smooth running of the hospital. Now this governing body forms standing committee like executive committee, finance committee, joint conference committee, and professional committee. That means governing body, they will form such type of different committees for the smooth running of the hospital. Then the second thing we can say, that is about the administrator. That is also the very much important role. The hospital, that is in general, is managed by the board of trustee or the governing council that will appointed by the government or corporation. We can say the hospital that is managed by board of trustee, or according to if it is run by the corporation, then accordingly it will be managed. But governing council, it will delegate the active management of hospital to the administrator. That means governing council will appoint one of the administrator for the smooth running, or we can say for the management of the hospital. The administrator, he should be the specialist in administration, an educator, a community advisor, and an organizer. And we can say preferably he should be MBA with the hospital administration. Now the function, what administrator has exactly to do in the hospital. So as a function, we can say administration, he will do liaison between the medical staff and the board of trustee. Administrator, he will enforce and frame the policies decided by the governing body in daily management routine. देखिए यहाँ पे क्या है कि गवर्निंग बॉडी है, वो हमेशा हर एक स्टाफ को मिलके सभी कुछ चीज नहीं कर सकते, तो यहाँ पे इसलिए एक एडमिनिस्ट्रेटर है who will frame the policies. वो पॉलिसीज फ्रेम करेंगे जो भी यूजफुल रहेंगे फॉर द स्मूथ रनिंग ऑफ हॉस्पिटल. He executes overall policies, rules, regulation in the hospital. The execution, that is also important. So this will be done by the administrator. He has responsibility to arrange the training program for the interns, nurses, volunteer auxiliary workers, and doctors. So here the administrator, they have to arrange the training program for the updation of the knowledge of the staff. Then he is responsible for the smooth running of outpatient department. He is also responsible to create a good work environment in a hospital for the medical and paramedical staff. He prepares a budget for the hospital and take approval from governing body. See, in the classification we have considered that there will be the profitable and non-profitable hospital. So accordingly, the administrator has to play a role. Accordingly, he should prepare the budget for the functioning of the hospital. So these are the function of the administrator. Then medical staff. Every hospital must have medical staff responsible for all medical care to be provided to the patients. The framework of the medical staff that varies hospital to hospital. We can say it is dependent on the size of the hospital. कितने बेड की हॉस्पिटल है उसके ऊपर भी डिपेंडेंट होता है ये कि कितना स्टाफ रहेगा, कितने स्टाफ है, मेडिकल स्टाफ की जरूरत है. However, in big hospitals, staff may be divided into the residential medical staff, associate medical staff, consulting medical staff, and honorary medical staff. So, first one, the residential medical staff. Residential medical staff is available on 24-hour services and is available round the clock to attend the patient. They are also involved in organizational and administrative duties pertaining to the medical staff. Residential medical staff, he will be available in a 24-hour service. That means they will live in a quarter in a hospital only. That means 24 hours they are available to attend the patient. Then the associate medical staff, they are the practitioner. They are appointed and assigned to various services in the same manner as the member of the active medical staff. Then consulting medical staff. Consulting medical staff, they consist of medical practitioner of recognized professional ability, that means of special ability, and are not member of other preceding categories of the medical staff. Then the honorary medical staff. Honorary medical staff is like a part-time consulting medical staff. The personnel of this group may be retired or emeritus physicians. Emeritus physicians, that means having retired but allowed to retain their title as an honor. So we can say they are the honorary services. That means the honorary medical staff, the personnel of this group may be retired or emeritus physicians, or those practitioners who have their own clinic but provide the honorary service to the hospital. यहाँ पे ऑनररी मेडिकल स्टाफ मतलब हम कह सकते हैं कि जिसको अपनी खुद की क्लिनिक है या फिर जो रिटायर्ड हो गए हैं, वैसे मेडिकल स्टाफ भी दे कैन सर्व इन अ गवर्नमेंट हॉस्पिटल और इन एनी अदर हॉस्पिटल. और बहुत से केस में ऐसा भी है कि गवर्नमेंट हॉस्पिटल में अगर कोई रिटायर्ड है, रिटायर्ड स्टाफ है, दे कैन ऑल्सो वर्क एज अ ऑनररी. सो सच अ पर्सन, सच अ डॉक्टर्स, दे आर नोन एज अ ऑनररी मेडिकल स्टाफ. Then this medical staff, we can say they are again subdivided into the different state of different clinics, on the basis of clinical division, or we can say based on the degree of specialization, we can divide the medical staff. So we can divide into two categories. First one, that is the medicine division, and another one, that is the surgery division. In medicine division, we can say internal medicine, cardiology, gastroenterology, nephrology, pulmonary disease, psychiatric and neurology, allergy, the skin and venereal disease, endocrinology, geriatric, immunology and pediatrics. This will be included in the medicine division. Same way, in a surgery division, there will be general surgery, obstetric, gynecology, orthopedic surgery, ophthalmology, otolaryngology, dental and oral surgery, nephrology, neurological surgery, cardiothoracic surgery, plastic surgery and anesthetics. So based on the degree of specialization, we can divide the medical staff, or we can divide the service of the doctors in a medical division as well as in a surgery division. Now, associated medical services. See, we are here we are discussing about the organization structure and about the medical staff. So here we need to consider about the associated medical services. So in addition to the medical staff involved in the diagnosis and treatment of the diseases, there are some other medical services wherein medical staff is the chief and help the main medical staff for the diagnostic and treatment. तो यहाँ पे डायग्नोसिस के लिए ऑलरेडी एक स्टाफ है that have been appointed, and again to help them for the diagnosis purposes, the special staff that has been appointed, and that is known as a associated medical services or associated medical staff. So first services we can say that is the pathology and clinical biochemistry services. Here the medical test for the various samples of blood, urine, sputum, feces, etc. for the presence of pathogenic infection or abnormality in biochemical parameters like sugar, urea, etc. they are carried out as per the instruction of the physician or surgeon. यहाँ पे फिजिशियन या सर्जन डायग्नोसिस के लिए बहुत बार ऐसा होता है कि डिसीज के लिए डायग्नोसिस के लिए लेबोरेटरी या फिर क्लिनिकल टेस्ट या फिर पैथोलॉजी लेबोरेटरी की जरूरत होती है, और हम कह सकते हैं यहाँ पे ब्लड, यूरिन, स्पूटम, फीसिस वगैरह सबकी पैथोजेनिक इन्फेक्शन के लिए टेस्टिंग की आवश्यकता हो सकती है. तो इसके लिए द फिजिशियन और द सर्जन ही विल अपॉइंट और ही विल गिव द डायरेक्शन to the staff for the pathology or for the testing purpose. The head of the service is a medical person. He is qualified in a branch of pathology. So pathology and clinical biochemistry services, we can say it plays very much important or the vital role for the diagnosis of the disease. Then another one, that is the radiology. Now this one is the branch of medicine which deals with the diagnostic and therapeutic application of radiant energy, chiefly in the form of X-ray and radium. Here the X-ray or the radium that is used for the diagnosis purpose or for the X-ray purpose. The department is headed by an MD, Radiology. The therapeutic use of radium or sealed radioactive source in the hospital is limited to physicians who are permitted in consultation with and consideration of the recommendation of the radiologist and or radiation safety committee. That means यहाँ पे radiologist or radiation safety committee जो भी रहेगी that will work in the consultation with the physician, and if the physician, if in certain condition, if it is required, then he will direct them to the radiology department. Only suitable, trained and experienced person, they are allowed to handle the radioactive substance. Radioactive substance, they are very much dangerous. So always need the care should be taken meanwhile the handling of such a things. So always suitably trained and experienced person, they are allowed to handle such a radioactive substances. See, the department should have the following facility. For example, first one we can say that is the facility of the sonography, then computer aided tomography, CAT scanning, that is also known as a CT scanning, and magnetic resonance image, that means MRI. See, the sonography. Sonography is a diagnostic medical test that uses high frequency sound waves, also called ultrasound waves, to bounce off of a structure in the body and create an image. देखिए यहाँ पे sonography specially हम use करते हैं to create one of the image, and the structure in the body. And sonography is useful for the evaluating the size, shape and density of the tissue to help diagnose certain medical condition. देखिए यहाँ पे pictorial view में दिखाया है. First one, what to expect during a sonography test. First one क्या होगा कि gel that will be applied to the part of the body that needs the imaging. जहाँ पे आपको sonography लेनी है, especially the gel that will be applied on the part over here, for example. Then transducer that will be moved around the skin. Transducer, that means a device that converts variation in a physical quantity such as a pressure or we can say the brightness that will be into an electric signals. That means this will send one of the electrical signals. And the third one we can say with the help of transducer, ultrasound waves from the transducer bounce off of a structure. जो भी structure है उसका bounce मिलेगा वहां पे, bounce off, and that will be recorded. Bounce off of structure in the body to create image, और वहां पे image computer screen के ऊपर image है वो create हो जाएगी. So this one is the sonography. Here we are using the ultrasound waves. Then computer aided tomography, that is also known as a CT scan or computed tomography scan, is a medical imaging procedure that uses the computer process combination of many X-ray measurement taken from the different angles to produce the cross-sectional tomographic image. Tomographic image मतलब हम कह सकते हैं कि यहाँ पे slice, virtual slices will be created by the numbers of X-ray measurement. So, of spatial area of a scanned object, allowing the user to see inside the object without cutting. यहाँ पे ऑब्जेक्ट को कट किए बिना, कट करने की जरूरत नहीं है और सीधा हम इनसाइड जो भी है वो देख सकते हैं. या फिर we can have the CT scanning with the help of X-ray. देखिए यहाँ पे हम X-rays का यूज कर रहे हैं for the measurement, and we could have some slices or the cross-sectional images of the object. So this is about CT scan. Then MRI. MRI, that is the magnetic resonance imaging. It is a medical imaging technique used in the radiology to form a picture of the anatomy and the physiology process of the body. MRI scanner uses strong magnetic field. यहाँ पे strong magnetic field का use होगा. Magnetic field gradient and radio waves to generate the images of the organ in the body. See over here we can have directly the images of the organ in the body. So यहाँ पे क्या है कि we are not using X-ray. तो अगर हम consider करें तो compared to CT scan, this will be good. MRI, that is comparatively good. Then blood bank. In hospital there will be the blood bank. Especially it collects, process and supplies the blood and its products as like blood plasma and platelets. Number of blood banks they are run as a main activity of the Red Cross Society, such other they are the voluntary bodies such as the Sarvodip Blood Bank, then Navdeep Voluntary Blood Bank, then GMERS Medical College and Hospital Blood Bank. That means blood bank, they are attached with the hospital. So many voluntary bodies are there, and they are doing and they are collecting the blood and the processing and supplies of blood they are doing. So blood bank, that is also important role of the hospital. Then medical social service department. This department, it provides an important liaison between the hospital and the patient and his relative. देखिए हॉस्पिटल में बहुत से बार ऐसा होता है कि कई दिनों के लिए रुकना पड़ता है. Then there should be some social services, or we can say social workers, who should help the patient and his relative. The qualified social worker represent a discipline whose professional focus is on the social aspect of the patient and his family. They generally provide information to patient regarding the risk and benefits related to medical and surgical treatment. तो यहाँ पे मेडिकल सोशल सर्विस डिपार्टमेंट है, तो वहाँ पे जो भी सोशल वर्कर्स रहेंगे, दे विल हेल्प द पेशेंट एज वेल एज द रिलेटिव्स. सो द ट्रीटमेंट, कई बार पेशेंट को है वो मालूम नहीं रहता एग्जैक्टली कि क्या रिस्क है और क्या बेनिफिट है सर्जिकल ट्रीटमेंट के. सो द सोशल वर्कर, दे विल एक्सप्लेन अबाउट द डिसीज डायग्नोसिस एंड द रिस्क एंड बेनिफिट्स. Then anesthesia services. Directed by a doctor, member of the medical staff who has got special training and is responsible for the proper administration of the anesthetics. So यहाँ पे anesthesia, he is also anesthetic. He is also responsible for the following. For example, the quality of anesthesia care, then availability of the equipment necessary for the administering anesthesia, then development of regulation concerning anesthesia safety, जो भी regulation requirement है regarding the safety of anesthesia, then evaluation of anesthetic care retrospectively, that means dealing with the past event or situation. If there is there should be any change in the treatment, then the anesthesia service, they will, or anesthetic doctor, he will do such type of evaluation कि पास्ट में जो भी कोई इवेंट हुआ है और उसके ऊपर से अगर पता चलता है कि यहाँ पे चेंजेस करने की जरूरत है, then he will do such type of evaluation of anesthetic care. Then supportive paramedical services and staff. सपोर्टिव पैरामेडिकल सर्विसेज में आएगा नर्सिंग सर्विसेज, देन डायट्री सर्विसेज, मेडिकल रिकॉर्ड सर्विसेज, सेंट्रल स्टेराइल सर्विसेज डिपार्टमेंट एंड फार्मास्यूटिकल सर्विसेज. वी विल सी वन बाय वन. नर्सिंग सर्विसेज. फर्स्ट वन, अ नर्स इज अ केयर गिवर फॉर अ पेशेंट एंड हेल्प्स टू मैनेज फिजिकल नीड्स, प्रिवेंट इलनेस एंड ट्रीट हेल्थ कंडीशन. देखिए हॉस्पिटल सिस्टम में नर्सिंग सर्विसेज का बहुत ही इंपॉर्टेंट रोल है, क्योंकि यहाँ पे डॉक्टर्स है या फार्मासिस्ट है, अगर हम कंसीडर करें तो मैक्सिमम अगर सबसे ज्यादा कोई कांटेक्ट में रहता है पेशेंट के तो वो नर्स है. तो ऑलवेज नर्स का रोल है वो, अगर हम इलनेस को प्रिवेंट करने में या फिर अगर हम कंसीडर करें तो यहाँ पे नर्स का रोल है वो बहुत ही इंपॉर्टेंट है. Satisfying the nursing needs of the patient or the community. Nursing care encompasses health promotion, the care and prevention of disease or disability. In rehabilitation center also they plays important role. Teaching and counseling and emotional support as well as cure of illness. देखिए स्पेशली पेशेंट की जो भी इलनेस है उसको क्योर करने में सबसे बड़ा रोल है, तो वो हम कह सकते हैं दैट इज ऑफ nursing department. Then nursing personnel should respect individuality, dignity and right of the every person regardless of their race, color, breed, national origin, social and economic status. देखिए नर्सिंग पर्सनल को कहीं पे भी भेदभाव नहीं रखना चाहिए, कहीं पे भी वैसे हम देखा जाए तो ये सबसे हार्ड जॉब है हॉस्पिटल के अंदर, क्योंकि कहीं पे भी बायसिंग नहीं होना चाहिए। द नर्सिंग डिपार्टमेंट फंक्शन अंडर द हेड ऑफ द नर्सिंग, शी मे ऑल्सो बी द हेड ऑफ द स्कूल ऑफ द नर्सिंग एंड विच मे बी एन एडेड रिस्पॉन्सिबिलिटी। तो यहाँ पे नर्सिंग डिपार्टमेंट है दैट विल वर्क अंडर द हेड ऑफ द नर्सिंग and the same they might be the head of the school of nursing also. Then dietary services, this service function under the nutritional department. This department will effectively apply the principle of science of nutrition to the preparation of palatable and appropriate food. यहाँ पे this department, dietary services, they will work effectively to apply the science of nutrition. Science of nutrition मतलब healthy food जो भी मिलेगा उसके लिए they will work and to the preparation of palatable and appropriate food. Palatable, that means we can say the pleasant to taste, that means which are having the pleasant taste, like that the food should be given. The services are usually in the charge of qualified person and supported by adequate number of dietitian, technical and clerical staff. They are also engaged with the purchasing, planning and preparation of the menus both for the patient and employees. देखिए according to the treatment और जो भी डिसीज है पेशेंट को उसके मुताबिक उसका मेनू क्या होना चाहिए, तो that will be decided by the dietary services. This will be also for the patient as well as for the employees of the hospital. So यहाँ पे dietary services को healthy food कैसे मिलेगा और effective food कैसे मिलेगा पेशेंट को और एम्प्लॉई को, वो यहाँ पे देखना है। Dietitian is generally responsible for recording dietary histories of patient, especially about the person with food allergies and those unable to accept limited diet scheme, interviewing patient and ascertaining their habits. देखिए यहाँ पे डाइटिशियन का एक दूसरा बहुत ही इंपॉर्टेंट रोल है कि यहाँ पे क्या करना है कि फूड एलर्जीज, बहुत बार क्या होता है कि बहुत सारे पेशेंट को चीज है, मिल्क प्रोडक्ट है, मिल्क प्रोडक्ट की एलर्जी रहती है, तो जनरली बहुत सारी मेडिकेशन है दैट हैज बीन प्रिस्क्राइब्ड विद द with the milk. तो यहाँ पे क्या है कि डाइटिशियन को पहले तो पेशेंट का इंटरव्यू करना पड़ेगा और उनकी हैबिट क्या है वो देखना पड़ेगा। बहुत बार बहुत से पेशेंट है तो they cannot digest the milk. So यहाँ पे dietary service जो भी responsible person है they have to study or they have to know about the history of the patient and by doing the interview, and on the basis of that the food allergies that should be detected, and on the basis of that the person they can choose this particular menu to the patient. They are also involved in counseling patient and their families concerning normal or modified pattern of diet and encouraging them to participate in planning their own normal or modified meal system. देखिए बहुत बार पेशेंट के लिए कुछ डाइट प्लान अगर हो तो यहाँ पे डाइटरी सर्विसेज में जो भी पर्सन वर्क कर रहे हैं वो उनकी फैमिली, पेशेंट या फिर उनकी फैमिली का काउंसलिंग कर सकते हैं और काउंसलिंग के बेसिस से उनको एनकरेज कर सकते हैं कि भाई ये फूड है आपके लिए अच्छा रहेगा. सो दीज आर द फंक्शनिंग ऑफ द डाइटरी सर्विसेज. देन मेडिकल रिकॉर्ड सर्विसेज. मेडिकल रिकॉर्ड देखिए बहुत ही बड़ा और एडमिनिस्ट्रेटिव वर्क है ये कि मेडिकल रिकॉर्ड, और थोड़ा एक्टिव भी है कि मेडिकल रिकॉर्ड रखना बहुत बार बहुत डिफिकल्ट होता है. तो इन हॉस्पिटल it is required to maintain adequate medical records of their patient. They must be accurately documented, readily accessible, and should be easily used for retrieving and complying information. तो यहाँ पे बहुत बार डेटा है वो रिट्राइव करना पड़ता है. So in such a condition there should be some record services in a hospital. The medical record services purposes. It will serve as a basis for planning and for continuing of the patient care. to provide means of communication among the physician and any professional who can contribute to the patient care, to furnish the documentary evidence for the course of the patient's illness and treatment during the each hospital stay. देखिए बहुत बार क्या होता है कि हॉस्पिटल में एक बार पेशेंट आया है, फिर वहां से रिफर होता है दूसरी हॉस्पिटल के लिए. सो इन सच अ कंडीशन दिस विल फर्निश डॉक्यूमेंट्री एविडेंस कि पहली हॉस्पिटल में क्या क्या हुआ है, क्या ट्रीटमेंट हुई है, कौन कौन सा डायग्नोसिस किया है. सो दिस ऑल द थिंग्स दैट शुड बी इंक्लूडेड इन द मेडिकल रिकॉर्ड सर्विसेज to serve as a basis for review, study and judging the care rendered to the patient. क्या क्या रिव्यू हुआ है, आगे कौन सी स्टडी हुई है, that can be easily evaluated with the help of this. To assist in protecting the legal interest of the patient, hospital and practitioner who carries the great responsibilities. See, बहुत से लीगल इश्यूज में भी ये बहुत इंपॉर्टेंट होता है. बहुत बार लीगल इंटरेस्ट के लिए भी पेशेंट के साइड से भी हम देख सकते हैं और हॉस्पिटल और जो भी डॉक्टर्स है who is treating the patient, in that case also to protect some legal issues there should be the record of such as services. To provide data for use in research and education. देखिए बहुत बार ऐसा भी होता है कि रिसर्च के लिए भी ये सब डेटा है, that will be very much helpful. बहुत बार ऐसा होता है कि कई बार कोई मेडिकेशन है that has been prescribed to the patient. In certain condition there might be some side effect of certain medication. So on the basis of medical record services that can be easily evaluated. So the data that is very much helpful in a research as well as in a education. Then medical record service, it includes a full and detailed medical record is one which includes the identification, sociological data, personal family history, history of the present illness, physical examination, spatial examination, such as the consultations, clinical laboratory data and X-ray, etc. So these all the things that should be included in a medical record services. It also includes the provisional or working diagnosis, क्या diagnosis अभी चल रहा है, medical or surgical treatment, drug prescription, gross and microscopic pathological findings, progress notes, final diagnosis, condition of discharge, follow-up and autopsy finding. So these are all the things that has been included in a medical record services. Then अगर हम यहाँ पे इसके पार्ट देखें, मेडिकल रिकॉर्ड के पार्ट, तो फर्स्ट we will start the data for the identity of the patient and admission chart or sheet. The first one, that is the data for the identity of the patient. देखिए यहाँ पे क्या चीज इंक्लूड होती है, नंबर नेम ऑफ द पेशेंट, रिकॉर्ड नंबर, एड्रेस ऑफ द पेशेंट, टेलीफोन नंबर, सेक्स, डेट ऑफ बर्थ, प्लेस ऑफ बर्थ, वेदर द पेशेंट इज मैरिड और नॉट, ऑक्यूपेशन, रिफरिंग डॉक्टर्स नेम, कहाँ से रिफर होके आए हैं, एंड एड्रेस of that doctor, then diagnosis, date and time of admission, कौन से टाइम पे, कौन सी डेट पे the patient has been admitted in the hospital and the location within the hospital, हॉस्पिटल में कहाँ पे उनको स्टे दिया गया है, कौन से रूम में है, it means the ward in which he or she is to be kept. The purpose of the history at the time of admission is to record the patient's chief complaint and a description of his present illness. तो यहाँ पे क्या है कि जो भी डेटा सीट है इसमें पता चलेगा कि पेशेंट को क्या कंप्लेन है या फिर उसके बारे में, जो भी उसकी इलनेस है उसके बारे में डिस्क्रिप्शन, प्रेजेंट इलनेस का जो भी डिस्क्रिप्शन है, दैट विल बी नोटेड इन अ फर्स्ट द डेटा फॉर द आइडेंटिटी ऑफ द पेशेंट, और वी कैन से इट इज अ एडमिशन चार्ट और सीट. देन क्लिनिकल हिस्ट्री सीट. It provides the information of the past hospital admission with their subsequent diagnosis, operation and major injuries that have been experienced by the patient. The history of the childhood and adult infectious disease. देखिए यहाँ पे कोई हिस्ट्री में अगर कोई डिसीज हुई है तो उसके बारे में भी क्लिनिकल हिस्ट्री सीट में that should be mentioned in a clinical history sheet. और कोई इन्फेक्टियस डिसीज है तो उसके बारे में भी यहाँ पे हम लिख सकते हैं. Pregnancies with the details about the dates, result, complication, immunization data, the history of transfusion मतलब an act of transferring or donating blood or any blood product, that means the history of transfusion with the dates should be included, reaction and complication if any. Then current medicine, यहाँ पे current में जो भी medicine patient ले रहा है उसके बारे में भी information clinical history sheet में रहेगा. Current medicine, pertinent sociological data covering habits with alcohol diet, heights and weight. देखिए यहाँ पे अगर पेशेंट को कोई हैबिट है तो उसके बारे में भी इंफॉर्मेशन क्लिनिकल हिस्ट्री सीट में रहेगा. देन अबाउट द अल्कोहल, हैबिट्स ऑफ अल्कोहल और हैबिट्स ऑफ डाइट एंड देयर हाइट एंड वेट. देन डेट ऑफ बर्थ, कंट्री ऑफ बर्थ, एजुकेशन, मिलिट्री हिस्ट्री इफ एनी, देन ऑक्यूपेशनल हिस्ट्री, स्टेटस अबाउट द मैरिज, हेल्थ ऑफ द वाइफ और हस्बैंड एंड फैमिली हिस्ट्री. देखिए फैमिली हिस्ट्री भी बहुत बार इंपॉर्टेंट है. देखिए बहुत सी कंडीशन में डायबिटीज है तो that will be transferred to their daughter or son. So here the family history that should be mentioned in the clinical history sheet. Physical examination sheet. Physical examination sheet, it records the information about the routine systemic review of the skin, head and neck, then cardiorespiratory services, cardiorespiratory, then breast and gastrointestinal. Cardiorespiratory, that means it carries cardiorespiratory system अगर हम consider करें तो यहाँ पे क्या होगा कि it carries the oxygen to the muscle and organ of the body and also it removes the waste product including carbon dioxide. तो यहाँ पे heart और respiratory system है उसके बारे में information. Then urinary, genitalia, then endocrine, metabolic state, lymph nodes, hematological, muscular, skeletal and extremities, urological, psychiatric and allergy. These all things should be included in the physical examination sheet. This data is received by the physician before he proceed to a line of treatment to be followed during the patient stay in the hospital. मतलब यहाँ पे ये सब इंफॉर्मेशन कब देना पड़ेगा कि जब ट्रीटमेंट स्टार्ट होगा. ट्रीटमेंट स्टार्ट होने से पहले ये पूरी इंफॉर्मेशन फिजिशियन के पास होना चाहिए रिगार्डिंग जो भी उनका ट्रीटमेंट पेशेंट का चल रहा है या फिर जो भी एलर्जिक कंडीशन है तो ये सारी इंफॉर्मेशन आएगी फिजिकल एग्जामिनेशन सीट के अंदर. देन लेबोरेटरी सीट, दिस इंक्लूड दोज ऑब्टेन्ड फ्रॉम द केमिस्ट्री, hematology, that means the study related to blood or blood forming organ and blood diseases. Then microbiology, serology, that means study diagnostic examination of the blood serum. Then pathology as well as the radiology department. तो ये सब डिपार्टमेंट से जो भी लेबोरेटरी के टेस्टिंग या फिर उसके रिजल्ट रहेंगे ये that should be included in the laboratory sheet. Then follow-up and medical treatment sheet. All procedure for the treatment carried out on the patient are recorded with the medical record. जो भी ट्रीटमेंट अब तक हो रही है या फिर चल रही है, whatever the procedure that is going on, that should be recorded in a medical record. Operative notes are also included in the record and contain both a description of the findings as well as the detailed account of the technique used and the tissue removed. देखिए यहाँ पे जो भी टेक्निक हम यूज कर रहे हैं डिसीज क्योर करने के लिए, that should be included in a medical record that is known as the operative notes. Operative notes यहाँ पे रखना पड़ेगा कि जो भी अभी चल रहा है ट्रीटमेंट उसके बारे में notes. Then progress notes, they are made in this sheet of medical record for the purpose of providing the physician with the chronological picture and analysis of the clinical course of the patient. देखिए यहाँ पे chronological picture एक create करना पड़ेगा और या फिर हम कह सकते हैं कि जो भी treatment, first treatment, then afterwards second treatment, or there has been the changes in the medicine, then it should be included in the progress notes. Then changes in any other thing, changes in the laboratory test, test. So that should, these all the things, जो भी progress हो रहा है यहाँ पे patient का या फिर disease के बारे में जो भी progress हो रहा है या फिर patient के physical condition में जो भी changes हो रहा है, that should be included in the progress notes. Then discharge summary sheet. See, this one is the last procedure we can say. Upon the discharge from the hospital, the patient record is entered into the discharge summary notes. जब भी patient वहां से discharge हो रहा है कोई भी hospital में से, then it should be included in the discharge summary notes. The purpose of this is to provide recapitulation of the patient's hospitalization. देखिए, recapitulation, that means the act of summarizing and restating the main point of something. That means यहाँ पे क्या है, जो भी डिसीज के बारे में जो भी अभी तक में डायग्नोसिस हुआ है, उसके बाद लेबोरेटरी टेस्ट हुआ है, उसके बाद में ट्रीटमेंट जो भी दी गई है, that should be summarized in a final discharge summary sheet. Send a copy of this discharge summary with the patient whenever he is transferred either to another hospital. देखिए, बहुत बार पेशेंट एक हॉस्पिटल से दूसरे हॉस्पिटल में रिफर होता है फॉर द हायर ट्रीटमेंट. So in that condition also, this copy of this discharge summary that should be sent with the patient to the another hospital. Some of the items that is included in the discharge summary, they are a brief history, result of physical examination, laboratory data, description of the patient hospital course, the diagnosis, the present conditions, medication that have been sent with the patient, a list of operations performed, क्या क्या ट्रीटमेंट हुई है, ऑपरेशन अगर परफॉर्म्ड हुए तो क्या क्या ऑपरेशन परफॉर्म्ड हुए, कॉम्प्लिकेशन ऑफ द पेशेंट, कंडीशन एंड एस्टिमेटेड लेंथ ऑफ डिसेबिलिटी व्हिच मे बी एक्सपेक्टेड. सो दिस ऑल द थिंग्स दैट शुड बी इंक्लूडेड इन द डिस्चार्ज समरी शीट. तो जो भी डॉक्टर के पास अगर ये यहाँ से कहीं पे दूसरी जगह पे पेशेंट रिफर हो रहे हैं या फिर आफ्टर some time again there is a condition of the disease, so in this condition the another doctor he will come to know about the treatment. Discharge summary sheet, it should also include, see, in certain condition if the patient dies while in the hospital, then there should be a autopsy report, and autopsy that has been performed, the medical record will contain a complete details of the findings that have resulted from such a post-mortem examination. मतलब यहाँ पे पोस्टमार्टम एग्जामिनेशन अगर होता है, अगर देखिए यहाँ पे कोई पेशेंट की डेथ हो जाती है हॉस्पिटल में, सो इन दैट कंडीशन आल्सो देयर शुड बी द रिपोर्ट ऑफ पोस्टमार्टम दैट शुड बी इंक्लूडेड इन अ डिस्चार्ज समरी शीट. देन सेंट्रल स्टेराइल सर्विस डिपार्टमेंट. तो अब तक हमने जो भी कंसीडर किया वो सब था रिपोर्ट सर्विसेज के अंडर में, और अभी हम देखते हैं Central Sterile Service Department. This department, it will supplies all type of sterile items required for the nursing unit. They include sterile linen, sterile kits, operating theater packs, then needles, syringes, etc. This all should be supplied by the Central Sterile Service Department. In addition, this department also provides the personnel to clean, inspect, repair, assemble, wrap, and sterilize by the special treatment and prepare the types for the various nursing unit and operation theater etc. मतलब यहाँ पे सेंट्रल स्टेराइल सर्विस डिपार्टमेंट में जो भी पर्सन काम कर रहे हैं वो और ये डिपार्टमेंट है, दे विल प्रोवाइड द पर्सनल आल्सो फॉर द स्टेरिलाइजेशन पर्पस. अगर एक ऑपरेशन खत्म हुआ और उसके बाद में दूसरा ऑपरेशन है, सो इन बिटवीन देयर शुड बी द स्टेरिलाइजेशन प्रोसेस. तो स्टेरिलाइजेशन प्रोसेस की जहां पे भी जरूरत है, ये सभी जगह पे ट्रीटमेंट और द सर्विस विल बी प्रोवाइडेड बाय द सेंट्रल स्टेराइल सर्विस डिपार्टमेंट. दिस डिपार्टमेंट दैट इज अंडर द सुपरविजन ऑफ द क्वालिफाइड फार्मासिस्ट. Then pharmaceutical services. In this community practice of pharmacy, the pharmacist is aware of the doctor patient pharmacist relationship. देखिए बहुत ही important रोल है फार्मासिस्ट का यहाँ पे. In this setup, the doctor makes the diagnosis and prescribe the drug, and the pharmacist dispenses the medication. देखिए यहाँ पे फार्मासिस्ट का रोल बहुत ही important है. Pharmacist he will dispense the medication, and how to use the medication that will be described by the pharmacist. This is not true in the hospital or in an extended area facility. देखिए जो बड़ी हॉस्पिटल है वहां पे एक दूसरा यहाँ पे फोर्थ रोल भी एक आता है. In the hospital setup, we find a professional nurse being added to the doctor, patient, pharmacist trio, and making it a quartet. So this quartet assumes the major role and responsibility of administering all drugs to the patient unless the patient is allowed for a safe medication. तो यहाँ पे कोई भी अगर हॉस्पिटल को हम कंसीडर करें, then there will be the quartet. The quartet, that means that is of the first one we can consider, that is the patient, then afterward doctor, then pharmacist and nurse. So there should be the collaboration in between these four and for the effective treatment of the patient. So here we have studied about the organization of hospital. As a summary, we can consider the organization of hospital, governing body of the hospital, the administration staff, or we have discussed about the administrator, and then the medical staff, associated medical staff, associated medical services, that means pathology and clinical biochemistry, radiology, blood bank, medical social services department, anesthesia services, and we have discussed about the supportive paramedical services and staff. In that we have considered the nursing services, dietary services, medical record services, central sterile service department, and about the pharmaceutical care, pharmaceutical services. So here in this lecture we have studied about the organization of the hospital and the medical staff. So here the first chapter we are ending over here, the first chapter hospital and its organization, that is completed over here. In next lecture we will consider about the hospital pharmacy and its organization. So thank you for watching this video. Thank you very much.